내 이름은 차도연, 나이 28세. 흔히들 다중인격이라고 하죠. 신세기, X, 나나, 안유섭, 안유나, 페리바.
First, let's take a look about what is DID. DID, or formerly known as multiple personality disorder, is a severe form of dissociation. The person will feel disconnected from reality and lose awareness of what happens around him. DID patients will feel disconnected from their own thoughts, memories, feelings, actions, or sense of identity. DID develops as a coping mechanism to help the person to shut off or distance themselves from their own traumatic or painful experience, such as physically abused and sexually assaulted during their childhood. DID is characterized by the presence of two or more distinct and split identities, or we call it alter. In fact, there is a person out there that has hundreds of alters. Isn't it amazing? And do you know that each alter or each identity has its own name, age, so it can be a child or it can be an elderly, sex, race, posture, gesture, and even different personality. And each alter will have its own function. Usually, patients will develop alter who is 5 to 6 years old to endure all the painful memories and traumatic experience so that the patients cannot remember it. And DID most of the time will be misinterpreted as a spirit possession. Typically, DID patients will also have dissociative amnesia. They cannot remember important information about their life, and dissociative fugue. They will temporarily lose their sense of personal identity and wander or travel away from their homes or places of work. As the alter reveals itself and be dominant, we call it as switching. When switching occurs, the alter can take 100% control over the patient's body. Switching can take seconds to minutes to days. Interesting facts about DID. Unfortunately, currently there is no cure for DID, so most of the patients need to live with it for the rest of their life. However, a combination of treatments might be useful to relieve the symptoms, and over time, the patients can learn to have more control over their behavior. DID is a very rare disorder. It only affects 0.1 to 1% of the world population. The famous people who suffer from DID are Roseanne Barr, comedian and actress, Adam Duritz, a musician and songwriter, and also NFL star Herschel Walker.
Certain condition and exposure during childhood will precipitate dissociative identity disorder. For example, childhood sexual, physical, or substance abuse, chronic stress during childhood, and serious medical illness during childhood will all increase risk of dissociative identity disorder. Besides, trauma-related experience such as repetitive or overwhelming trauma, persistent emotional neglect, history of PTSD, and childhood tragedy such as experiencing terrorism, war, prostitution will also increase the risk of getting dissociative identity disorder. For the pathophysiology, dissociation of this disorder happens as a coping strategy to survive the trauma when the brain and the personality are still developing during childhood. Under stress condition, the body will naturally act via fight or flight response. We are programmed either to face the stressor, which is fight, or run away from it, which is flight. Instead, they opt to face the situation through freezing or flopping. Freezing happens when the body becomes immobile. Chemicals are also released in the body that desensitize the body and the mind from the pain. Flopping, on the other hand, happens when the thinking process in the brain is shut off and the muscle becomes floppy. Freeze and flop are the basis of this dissociation. Let us dive into the details. The front part of the brain helps us to understand time and the space, the use of language and speech, store memories, processing information through senses, while the back of the brain is for automatic, instinctive function. When a person is facing a threat, less blood flows to the front area while the back of the brain is more activated. Reducing blood flow to the front of the brain makes it difficult to process what is happening and will lead to dissociation. Activation of the back of the brain, on the other hand, helps to protect oneself from a trauma via freeze or flop processes. Trauma causes split personality so that the patient does not suffer from the post-traumatic event every single time. When making a new personality, only some of those personalities remember that particular trauma. This is because a patient with DID feels as if different memories, sensation or belief happen to different people. The identity stays inside of him or her. It is useful in coping with overwhelming trauma as a child. However, upon growing up, the coping mechanism makes it hard to develop one clear identity.
Now, let's take a look on the main symptoms of DID. First, the patient will experience personality change because each alter has their own unique behavior and distinct characteristics. Second, they will have out-of-body experience. They feel like they are being pushed away from their own bodies. Third, amnesia. They tend to forget what the other alters were doing. They can't recall what's happening while the alter is being dominant. Sometimes, suddenly they find out they are in strange place, having difficulties to find their stuff, or strangers keep claiming they know the patients. And last, they will have disorientation of time, place, and situations. However, the patients can also experience depression, anxiety, delusion, and also suicidal thoughts.
For DID, there isn't a single diagnostic test that can diagnose it directly. It only involves review of symptoms and the personal health history and compare the person's condition with the criteria of DSM-5, which is a manual for the diagnosis of the DID or others mental illness. Symptoms of DID often show up in the childhood between the age of 5 and 10, so the parents and teachers should take note of this kind of symptom. Based on DSM-5, DID is diagnosed based on the following criteria. Firstly, the existence of two or more distinct identity or personality status. Each identity is accompanied by change in behavior, memories, and thinking. Secondly, the presence of amnesia, which is the inability to recall everyday events, personal information, or past traumatic events. Thirdly, presence of impairment of functioning in social, occupational, or other important areas due to the disorder. Fourthly, the symptoms are not part of normal cultural or religious practices. And finally, the symptoms are not due to the direct physiological effect of abusive substances or a general medical condition. Next, there's no way to prevent DID if the risk is already there. We can only slow down the progression by firstly, identifying the sign and start the treatment as early in life as possible to relieve the symptom. Next, parents and the caregivers should watch for signs in young children for early detection. In addition, early treatment should be started after episode of abuse or trauma to prevent DID from progressing. Furthermore, managing the triggers of DID such as stress and avoiding drug and alcohol may reduce the frequency of the dissociative identity. Other than that, child must be protected from the exposure to trauma, physical and sexual abuse. Last but not least, we should help the trauma survivor to deal with their past in a healthy way to prevent the development of this disorder.
Now, you are fully equipped with all information of DID, but how to treat DID? So just like the other disease, treatment of DID consists of both non-pharmacological and pharmacological management. Non-pharmacological management is a treatment regimen done without the use of medications. In DID, for instance, psychotherapy is widely done due to its high effectiveness. Pharmacological management, also known as pharmacotherapy, involves the use of medications. So let's go deeper. Let me explain to you about the psychotherapy or the non-pharmacological management in DID. But first thing first, we need to know the goals of the therapy, which are to process the painful memories because that's the source of this problem. Second, to manage the sudden behavior changes or switching. Third, for the patients to learn more effective coping skills. And last, to eliminate the other multiple identities or bringing the multiple identities into one functional person. Now, let's explore the different types of psychotherapy. And don't worry, I will explain each of them to you. The first therapy is Cognitive Behavioral Therapy or CBT. It focuses on the relationship between thought, behavior, and emotions. This therapy is based on the belief that every negative thought leads to negative behavior and negative emotions. A person with DID, for instance, who has suffered from abuse, might always expect negative outcomes in his relationship with surrounding people. CBT works by challenging these negative thoughts and replacing them with thoughts based in current reality. So, patients will be able to not think of negative things that are less likely to occur in the future. This will simultaneously help the patients to manage their depressions and process the past trauma. The second therapy, which is known as Dialectical Behavior Therapy, focuses on change and acceptance involving 4 skills, which are: first, distress tolerance, at which patients will be able to manage the overwhelming feelings. Second, mindfulness. Patients will be more aware of surroundings and things happening in the present. Third, interpersonal effectiveness. Patients will be more effectively communicate and assert the needs and boundaries in relationships. And the last skill, emotion regulations. Patients will be able to understand emotions and learn to write out the strong feelings without overreacting. The third therapy, or psychodynamic psychotherapy, focuses on better understanding unconscious aspects of suffering, so that the patients will be able to understand how the past affects their current behavior. Next, psychotherapy is eye movement desensitization and reprocessing. So its purpose is to reduce distress arising from the traumatic memories. So it works by changing the way the memories are stored in the brain and consequently reducing the vividness and emotions of the memory. So what happens is, the patient is required to think of the past trauma while performing physical tasks such as tapping, listening to sounds, or simply walking. So this is done to stimulate both sides of the brain and most commonly eye movement. And the very last therapy is Schematrapping. Schema is a mental state that a person develops to interpret their experience. In DID patients, they have negative schema with the lack of positive coping skills. So this schema therapy aims to help the patients to identify the schema and heal from the negative schema. It also helps to increase the awareness of childhood memories, emotions, and so on that go along with them, help the person to gain control on how they respond to the triggers of the trauma, and find the healthy ways to meet the core emotional needs as well as remove the power from the past traumatic memories. Other than psychotherapy, the patients can also perform the non-pharmacological management, including practice mindfulness, in which the patients become more accepting of the uncontrollable events, exercise, maintain the healthy diet such as avoiding processed food and excessive sugar, and then have the adequate sleep. And last, with the aid of therapists, they can also identify the trigger so that it is easier to avoid them in public. Let's move on to the last part of our video, which is pharmacotherapy. So the medications are used to control the symptoms faced by DID patients, since there is no cure for DID yet. For example, DID patients with depressions are prescribed with the suitable antidepressant. If DID patients experience uncontrolled anxiety, the doctors will give them anxiolytics such as moderate-acting benzodiazepine or SSRI. So this will help them to be more relaxed and reduce the muscle tension. The doctors can also prescribe them with antipsychotic agents such as aripiprazole and risperidone to help them in overcoming psychotic issues in which patients lose touch with reality. So with all these medications, patients are advised to inform the doctor or pharmacist if they develop any undesirable side effects, as well as no improvement on signs and symptoms in follow-up session.